Aortic regurgitation is the second most common cause of death in acute aortic dissection, most common cause being aortic rupture. It may occur in up to 3/4 of cases of Stanford Type A aortic dissection. There are several mechanisms for aortic regurgitation in aortic dissection. 1. Dilatation of aortic root and annulus. 2. Tearing of aortic annulus or cups of the aortic wall. 3. Displacement of aortic cusps in relation to each other, interfering with closure. 4. Loss of support for aortic cusps. 5. Intimal flap interfering with closure of aortic cusps. Those with severe aortic regurgitation secondary to acute aortic dissection present with acute left ventricular failure and cardiogenic shock. Pericardial tamponade may also be associated if the dissection ruptures into the pericardial sac. In one study, there were 16 with intrinsically normal leaflets with aortic regurgitation due to correctable lesions. Incomplete leaflet closure due to aortic leaflet tethering in a dilated aortic root in 7. Prolapse of leaflet due to disrupted attachment in 8. And prolapse of dissection flap through the aortic wall orifice in 5. These defects were identified preoperatively by transesophageal echocardiography. Of this 16, successful aortic wall repair were achieved in 15, while one needed aortic replacement after a complicated intraoperative course unrelated to the aortic wall. Here is an important journal reference. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.